Hello, all. You are very welcome to today's Retina International webinar entitled Advocacy: Who, What, When, and Why. Indeed, we are here today to discuss advocacy, namely the new Retina International Advocacy Toolkit. We'll explore how to use it and, of course, have a panel discussion with our amazing and experienced panelists today. My name is Fiona Waters, and I am the Community Engagement and Outreach Officer here at Retina International. Today, I am delighted to be joined by Sara Brown, Director of Government Affairs, Prevent Blindness USA, Clara Hervas, who's the Public Affairs Manager for EURORDIS and Rare Disease International, and of course, Dimitri Yanchev, who's a youth patient advocate with Pro Retina Deutschland from Germany. We look forward to speaking with them very, very shortly. First, though, I am delighted to talk very briefly about the Retina International Toolkit, which we are very happy to launch shortly. So this comprehensive resource has been designed to provide a framework for creating and implementing advocacy strategies, from picking your battle, generating data to support it, and then deciding on the most effective lobbying tools available to you. Retina International strives to enable our community to bring about positive change by thinking globally and acting locally. We do this by acting locally and we encourage you to think globally and act locally. We do this by generating data and resources that you, our membership, can use to support you in developing practical, structured advocacy strategies that bring about real and impactful change for those living with retinal degenerations. This toolkit can be found on the Retina International website, which is retina-international.org. If you click on the Participate tab up the top, which you can see now highlighted with a red circle, and then scroll down until you see Advocacy Toolkit. You can access a PDF and Word copy here. If you have any feedback, we're always delighted to hear from you. If you would like to share with us an example of a successful campaign that you ran or that you think may be useful to others and that others may be able to learn from, please do get in touch with us by emailing myself at fiona.waters@retina-international.org. This email address can be found at the bottom of that webpage that I shared with you. So without further ado, I am delighted to welcome our panel. Let's stop sharing now. Hello, everyone. So first up is Sara Brown. So Sara is the Director of Government Affairs for Prevent Blindness, and prior to her current role, Sara managed communications projects for the Defense Health Agency at the US Department of Defense's Military Health System. As an Associate Director for Government Affairs with the Medical Group Management Association, Sara represented the interests of practice managers on issues such as Medicare reimbursement policy and value-based care to Congress and the executive branch. Very welcome, Sara. Next up, we are delighted to be welcoming Clara Hervas, who is the Public Affairs Manager within the European and International Advocacy team of EURORDIS. In this role, she is responsible for developing and coordinating policy activities on global issues that affect people living with a rare disease globally, such as respect for human rights, universal health coverage, or the rights of people living with disabilities. Clara is also Public Affairs Manager with Rare Diseases International and Policy Coordinator at the NGO Committee for Rare Diseases, established as a platform to exchange with the United Nations. You're very, very welcome, Clara. Thank you for joining us. And finally, we are delighted to welcome Dimitri Yanchev. So Dimitar is a patient advocate with Pro Retina Deutschland, or Pro Retina Germany. Among other things, he has helped set up a coordinated group for young patients with IRDs from all around Germany. Dimitar was born and raised in Bulgaria, where he was diagnosed with retinitis pigmentosa in his early teens. He has just recently completed his PhD thesis in chem informatics at the University of Bonn and is currently working as a data scientist. So congratulations, Dimitar, on finishing your PhD, and we're delighted to welcome you here today. There will be time for a short Q&A towards the end of this discussion. So we will invite you to simply raise your hand by clicking Alt Y, and we will try get to as many of you as possible. So without further ado, Sarah, I might come to you first. So could you briefly introduce the advocacy work that Prevent Blindness does and tell us briefly about a successful campaign that you ran and the process or factors that made it so successful?
Sure. Well, first of all, thank you so much for having me here. I'm delighted to join all of you. So Prevent Blindness is a patient advocacy group. So we represent the patient on matters of health policy here in the United States. But our approach to vision and eye health is based on public health. And so how can we meet patients where they are? How can we get them the health care that they need for their eyes and their vision? So our messages are those of early detection and connection to care, which can really help prevent vision loss about 75% of the time. So to help achieve that effort, we work across all age groups and diseases and conditions, so our focus is very broad. In addition, we also work with ophthalmology, with optometry, with public health practitioners, community health practitioners, schools. We really are very broad in our focus because vision and eye health is something that affects everybody, and everybody needs vision and eyesight to see and live engaging lives. And we're here to make sure that people are not needlessly losing their vision. So one recent campaign that we have just seen some success on was to address a production shortage of a drug that treats thyroid eye disease. So as the COVID-19 vaccine production is increasing here in the United States, there was a recent decision made at the US Food and Drug Administration to stop production of this treatment for thyroid eye disease so that more vaccines could be made, which is obviously understandable because we all want to see this pandemic come to an end. But for patients who live with this terrible condition, their treatments were stopped immediately as they waited for production to restart. And in some cases, some patients saw their disease regress. The angle that we took here is that Congress foresaw a drug shortage and saw that it could happen as a result of increased vaccine production. And so to help get ahead of that issue, they granted authorities for the FDA to make sure that no other drugs that patients rely on run in short supply while vaccines are being produced. So to help combat this effort, Prevent Blindness joined with a coalition of other interested organizations to launch a public awareness and grassroots advocacy campaign to urge FDA officials to use this authority granted to them by Congress and to help get production restarted. It took a lot of partnership and a lot of creative thinking about how to keep this issue alive with the media because it did go on for several months. How to keep knocking on doors of legislators, how to keep the public interested in this, and also how to get new advocates on our side, such as eye doctors who may not always have the time to advocate on behalf of their patients in a legislative fashion, but know firsthand how patients are suffering as a result of this disease and due to this drug shortage. We also had to be very careful with this issue. Obviously, we don't want to slow down or halt vaccine production so that we can get this treatment back on the market. That was clearly not our goal. We just wanted to make sure that the FDA was doing everything that they could do, including exercise its total authority to prevent these drug shortages. So our messaging focused on the disease itself and how burdensome it is for the patient who is now living with uncertainty of when they can resume their treatments. And our goal, again, was to encourage the FDA to use their authority to end the shortage. It took a lot of time, it took a lot of finesse, and a lot of creativity. But we were ultimately successful, and the drug is now being produced, and patients are accessing them, which is phenomenal news.
That's great. Thank you so much, Sarah. So I hear like a lot of speak about, building partnerships and building coalitions. So Clara, I might come to you on that next. So particularly in the rare disease community, this collective voice is essential. So how do you go about building consensus in a community with such a diverse range of needs and across so many borders? And could you share an example of that?
Yes, of course. Just to give a bit of background, to say that EURORDIS is an umbrella organization with over 900 member organizations and representing more than 70 countries. So indeed, there is a lot of people from across Europe to take account of, and a lot of different diseases, because there are actually more than 6,000 different rare diseases. So really the strategy of EURORDIS is to find those common challenges, especially when it was founded, it was just to prove that there is an added value of working at international level and at EU level in particular, create that cross-border collaboration, and especially for rare diseases, which are not well known and there's not enough expertise to really make those links between the existing expertise. So just to put that into context. And one of the things that we have to do then is to really make sure that we identify when an issue really falls within our mandate or not, whether we have that added value and whether we should do this alone or we should partner with others. So that's one of the key things, I think, whenever you go into advocacy, any type of advocacy, that you have to ask yourself. What we do a lot within EURORDIS is that we have working groups on different topics. We establish an advocacy group. So we give the opportunity to our members that are active in advocacy to apply to be members of this task force and working groups, and really contribute to the different topics that we work on. And then we always consider the broader membership by having open consultations when we are coming up with a specific position, especially if it's a new topic. And also very important to engage potentially other stakeholders. And we do that a lot through the organization of conferences where there's an opportunity for that to happen. So an example, sorry, just didn't mean to speak for that long, but recently we launched, well, in 2019, a campaign for the introduction of rare diseases within a political declaration that was being negotiated at UN level on universal health coverage. This has been a core priority for EURORDIS for a long time, but this was also an opportunistic kind of moment. You know, you see this piece of legislation, well, soft law coming, and you want really to make sure that your population is considered. So we developed a position paper on the matter with consultation, with case studies. We organized an awareness raising event at the UN. And then we really engaged all our national groups. We provided them with tools, template letters, fact sheets on the matter so that they could involve their national authorities and make sure that when the vote was coming at UN level, this would happen. And it did happen. So that was a success. And what we wanted to make sure is that in the implementation, so because that is the document, but then at national level, you need to make sure that that actually comes into effect. So we developed another toolkit to help our national members really convince their member states on how to include the issues of rare diseases within their universal health coverage strategies.
Thank you very much, Clara. So we've heard some really, really good examples of like national advocacy from Sara and also international advocacy from Clara. So I'm really interested to hear about more on a local level from you, Dimitar. So when you were establishing the youth group, which was something from the ground up, how did you go about that? What motivated you to get involved in advocacy, and how did you build that local youth network from the ground up? Just going to ask you to unmute.
Oh, yeah.
There you
Can you hear me now? Sorry, yeah.
Perfect.
First, thanks for inviting me, of course. Very, very happy to see every one of you. And this is a very, very good question, because I actually didn't plan to go into patient advocacy, so it kind of happened by chance, more or less. So I didn't really have, of course, my motivation was, I'm a patient myself, and I saw the need, my personal need to connect with other people with the same disease or with similar disease progressions. And since I didn't really know any other young people with this disease, or I have heard that there's some, but never really got into contact with them. Of course, this was my initial motivation to do so. And it proved at the very beginning to be really hard because, you know, it was just hard to reach out to people. First, find the people, because obviously when it's a rare disease, so you don't have that many patients. And again, you have not that many young patients. And it's also kind of a disease, at least, you know, the inherited retinal degeneration is a disease which, you know, young people try to kind of avoid, and not really, nobody wants to get confronted with such a diagnosis. So many of the young people probably also try to, you know, kind of intentionally do not seek contact with others by just, you know, avoiding the topic more or less. So it was, I guess, my initial motivation to continue, although at the beginning it was really hard to establish a group of more than 2, 3, 4 people, was the knowledge that there are other patients like me out there that are, I don't know, between 25 or 30, or between any age which is less than 35. And I knew that there's somewhere in all of these social media groups on Facebook, Instagram, or WhatsApp, or whatever, but you know, consolidating that and really you know, channeling that energy from all these groups into one single place, which is close to the Pro Retina as a patient organization, was of course something which is which kept me motivated for the whole time. And yeah, I guess this was really something that this, as I said, to wrap it up, just the knowledge of others being there, and eventually they turned up to be, I mean, I got to know them. So now we have a huge group, like 80 people or so.
Yes, and you're very, very active and mobile is the word on the street. So congratulations on all your work so far, and we're really, really excited to see how your youth group grows. So we've spoken an awful lot about building networks from local to an international level, and the importance that that collective voice has, the weight that it has behind it. But another area that I'm keen to discuss here, and another thing that is really important to having weight behind your discussion and your cause, is the generation and gathering of data. So I was wondering, Sara, if I could bring you in here on this, and could you share with us a bit about how you gather and generate data, and how you use evidence in your campaigns?
Sure. Well, certainly. This is a point that I hear quite a bit from congressional staffers when I meet with them about vision and eye health. You know, they really enjoy, and they, you know, they need those personal anecdotes and stories. Those are very compelling. But at the end of the day, they are the ones who need to convince someone, probably their boss, whether it's the lawmaker themselves or their chief of staff in their office, somebody who might not have been in the room, why your request is important and why they should pay attention to it. This is something where data can help with that. So the process of gathering, generating, and using data and evidence, I've found, is sometimes very nonlinear. Sometimes it depends on your own capacity to find it. Sometimes as you're getting to know your issue and you're staying up to date on it and you're knowing what's out there, you'll run across something that somebody else might be working on, whether that's a news article, whether it's an academic journal of some kind. And then you start to think about, you know, how can I use this data point or this information to my advantage? You also might have to start thinking about, you know, does this kind of ruin the case that I've been making, or how can I put a fresh spin on it using this emerging information? So you kind of have to really think about that. I think this is also an area, especially for a small organization like Prevent Blindness, where the strength of partnerships is the most important. As an advocate, you know, there's a lot of pressure to know everything about your issue or understand everything from everyone else's perspective. And I'm telling you, that's just not possible. So you really need to connect with other people who can bring in that diversity of opinion and that perspective, and really coordinate on what data points resonate the best with both of you and what you're trying to accomplish together. And that's kind of where you build your frame and your messaging around that. And I think data, to kind of close on that, is most advantageous in campaigns when it can be echoed across a number of those diverse viewpoints and from a number of different perspectives. That way, the information that you're trying to convey in your advocacy campaign, or the message that you're trying to get across, isn't just about you and what you're trying to do. It affects a broader community in a lot of different ways. And so it really warrants that kind of attention.
Absolutely. So then again, we're getting that input of like those coalitions, those networks, and that collective voice is really, really essential, even when picking what data you want to use in your advocacy. So when you're communicating your evidence, whether it be to a decision maker or over social media, what are some factors to keep in mind? For
Come
Sarah.
off mute. Yes, sorry
Thank
about
you.
that. I think, you know, there is a lot of information out there. And I think the first thing that I think about is, you know, is this data credible? Does it come from a reputable source or a reputable person? Is it scientifically verifiable, or is it anecdotal? You know, if it's verifiable or not, that's not necessarily, you know, the nail in your coffin, so to speak. It really could just be signaling that there's a problem that's going to get bigger in time if you don't address it somehow by possibly some easy means. So there's always something that you can use with data, but at the end of the day, since you're the one who is advocating and wanting to bring your own sense of credibility to it, you have to ask yourself, is this something that I'm willing to put my own credibility on? Is it something that I stand behind? Is it something that is in lockstep with what we're trying to message? Excuse me. I think another thing to consider is, you know, just how you message that. You know, decision makers and social media consumers, they both have one thing in common, and that is that neither of them have a lot of time. Decision makers are constantly bombarded with information, and social media consumers are endlessly scrolling, trying to find that one piece of information that they can kind of latch around. So you want to kind of think about how to present that in a quickly consumable, but also a trustworthy manner.
Thank you very much. I froze there for a second. um, so, Clara, I might bring you in here. So, when we talk about the legislative cycle, so this is the cycle where it goes from the conception of a law to its drafting to voting on it and then to its implementation. What is the role of patients and patient-led organizations at various stages of the legislative cycle?
Yes, thank you for that question. I think, I mean, what EURORDIS looks particularly at the EU legislative cycle. So there are, as you said, there are a lot of stages where we can be involved. But I think one of the important things is we want to be from the moment of where a topic even becomes an issue. So really, even as we were talking now, gathering that evidence and disseminating it to policymakers to bring the topic to their table. So that's one of the first roles that the patient organizations can actually have, you know, at that stage of providing inputs into the needs of the population they represent, and really raising an awareness within policymakers. There is, of course, the gathering of the views of the members and coming up with a common position to present to those policymakers. And then there is, let's say, the classic processes that exist, especially within the EU, where there is fortunately a process of consultation, where we would come up with a position and really share it with our members, make sure that it really reflects the views of the community and input that into the process. Make sure then that we hold the policymakers accountable is like kind of the third part of that cycle. And we have to monitor the situation and keep campaigning even when that legislative file is approved. So there's really 3 moments where that needs to happen. And I think one thing that I liked on the toolkit that Retina International you released, there was the listen, learn, lead. And one thing we say, the way we put it as well in EURORDIS is that we have like 3 strands as well as empower, engage, and advocate. So you can never really go towards the third one, which is the advocate, if you haven't empowered your community with knowledge, with tools, really make them part of the process. And engage them is when we really try to put those people in positions of power where they can be part of the decision making. So we really lobby for them to become members of task force within national authorities, within, for example, the European Medicines Agency. We really have made the effort to create positions where the patients can really voice their needs and their concerns.
Thank you. And could you tell us a bit about how EURORDIS builds that capacity?
Yes, so one of the main things is obviously through our membership meeting. It's a moment where we gather everyone, we really share on the priorities, and we learn from our members what they consider should be our priorities, and we really come up with our activity plan together. But we also have programs we've created an open academy. So it's really, we have a summer school dedicated to learning about the entire process of medicinal development of medicinal products. We have a different academy, the winter school, for example, that's the summer school, and there's a winter school where it's more about the research process and how patients can be involved in clinical trials. So really trying to train our members as much as we can on ways in which they can take power over their own lives and be part of the decisions that affect their lives.
Absolutely, yeah, they're wonderful programs, and I think it really is important when asking people to engage in advocacy that they have the skills and the knowledge to be able to do it, which is something this toolkit also tries to address, that it's about emphasizing that there's a process to these things, and that it is a long process and it can be difficult, and as Sarah said, non-linear, but there is a process to it, and it's just about, as you say, knocking on those doors and going through those motions as many times as you can until you get the answer you want. So Dimitri, I might come to you. So with regard to the role of youth advocates, so Clara talked a bit about how patients can get involved in the different stages of advocacy. What role do you think youth advocates play, and why is their engagement so important?
Well, youth advocates are, of course, let's put it this way, a special type of advocates, because they're, obviously there is no clear definition for what's youth and what's young. But I guess why it's important to get them, get involved in the whole process is it's in general always good to involve young people in any decision-making process, because these are the people who are most probably going to either benefit or suffer from those decisions in the future. So especially for policy making, this is absolutely crucial. And it's this generational problem, or this generational gap which might arise if you don't involve these young people as patient advocates, because the needs of let's say in the concrete example of retinal degenerations, the needs of a 65-year-old, 70-year-old patient are completely different from the needs or interests of a person, of a patient, 25-year-old patient with inherited retinal degeneration. So this always needs to be taken into consideration. And furthermore, one additional aspect which is, I think, very important is that if you want to build long-term capacity, and patient advocacy is a long-term process, you usually don't see the results of your work immediately, not even in the foreseeable future. Most of probably you may see some results when you hear a success story about this and that, and you feel kind of yes, I have been there, I've participated in that, and I really feel kind of good about it. But usually you don't see that. Usually it's really a very long process, and policy making is a slow process itself as well. And if you want to build long-term capacity, you really need to involve young people as early as possible, because young people are also, these are also the people who have to, kind of they have to prove themselves in the early stages of their life, professionally, personally, in every other aspect. And if you want to build that capacity, you need to do it as early as possible, because otherwise you might lose really yeah, people with potential. And in the rare disease community, this might be crucial because you don't simply have that many patients. So it's just the absolute numbers might be really low.
Yeah, can I just quickly interject? Just really, I'm totally in agreement with Dimitar, and that is something that we are trying to do more and more, engage young people. And we really realized that in a recent project that we led called Rare 2030, which was about setting priorities towards 2030 and finding like the best possible scenario with a foresight study. And we really brought, almost for the first time, like a panel of young advocates to really, as Dimitri is saying, it's people who are going to see this affect their lifetime and are also going to become the future advocates. So you really need to make sure that they are part of the process from the beginning. So completely in agreement.
Thank you very much, Clara and Dimitar. So Dimitar, just back to you on the youth engagement side of things. What barriers do you think there are to young people participating in advocacy, either on a personal level or systemically? And what should we, as patient organizations, be aware of when trying to engage young people?
This is, again, a very good question. So I think in terms of barriers, it's the nature of patient advocacy itself. As I said earlier, it's just a very, it's a long-term process. You usually don't see the results of your work immediately, not even in the foreseeable future, which can lead to, becoming at some point desperate with it and just not wanting to proceed. Furthermore, it comes, especially, again, I'm talking only about the rare disease community, I don't know about the others, the fact that you might be alone or you might have only 2-3 other people around you, and everyone's facing completely different challenges personally. As I said, also young people in general, they always need to, in the shortest possible amount of time, you need to prove yourself personally, professionally, do everything what's expected from you to do. And, I don't have to explain you what are the current challenges in the digital age in front of everyone's. So I think it's just this interplay of the different aspects of the way of life that we're having now in 2021, and also the I would say the fruit which cannot be seen immediately. So this can really lead to people just dropping their work at some point if they don't see the immediate results. So I think it's extremely important for patient organizations to when they involve young advocates, just to really make sure that they give them I wouldn't say easy to reach milestones, but maybe something which can really motivate them to continue, and not to say, yeah, probably in 2 years we're going to have this or that. You really need to see the results of it, because obviously young people are impatient and they don't want to work for something in their free time voluntarily for something which might happen in 5 years. And alone, on top of that, usually alone or with 1, 2, 3 other people max.
Absolutely. So I'm hearing like that, again, that sense of community and sense of reward that you're working towards something in the short term can really keep that motivation alive. I think that's a really, really important thing for people to keep in mind as we do try to grow our youth councils and youth committees, that it's about setting those goals and feeling like you're making forward progress. So we've heard from Clara and Dimitar about mainly the rare disease side of patient engagement. Sara, I was wondering if you would comment. So obviously a large part of Retina International's work is on rare eye diseases, but another huge body of our work is to do with the aging retina. So Retina International and Prevent Blindness are part of Retina Action, which is a global coalition for the aging retina. Does what Dimitar and Clara does what they've said here resonate with you with the Asian community, or do you have any comments, or do you notice any differences?
I think a lot of the points that Dimitar, I'm sitting here nodding, just saying, yes, it is a challenge to get young people involved. I think it's not so much a challenge as getting, older folks involved with advocacy. I think it's just, it's kind of giving them, I think the challenge there is probably getting them more used to some of the new tools of advocacy that they might not be completely aware of, which, the young people love to tweet and, Facebook and et cetera, et cetera. Some of the older folks might, but they might not feel that it's effective, or they might not understand, just how their message is getting across. And so really communicating just, the value of just getting the information out there, because you never know who's going to see it. I think is a challenge, to getting them motivated to do that. I think the older community understands, at least in the States, how long it takes for something to happen. And I think, policymaking is so complicated that if you're not just working with Congress, but you're working with a federal agency to affect change somehow, I think you have to make it as personal to them as possible. One big conversation we're having in the States right now is how to lower the cost of drugs. That's something that, obviously is very personal to the older community that's wrestling with some of these high prices, but also has, might not have the income to afford some of these prescriptions. And so letting them know, just how soon some of these changes or what this change could actually mean, and just really trying to condense this complex information down, not into a soundbite, because that's more political, but just trying to make it as personal to them as possible, I think is the best way to get the older community involved and stay engaged.
Absolutely. I think you're right. I think in the age of social media, we're surrounded by language of policy, depending what circles you're in. But if you're maybe within the aging community, you're slightly older and not on these social media platforms, it can be harder to engage and to understand exactly the impact and the path and the progress that can be made.
Mm-hmm.
So, Sarah, I just want to ask you, what are some common mistakes or downfalls that you have observed in advocacy campaigns, and how can one avoid them?
Well, answering this from more of a professional advocate perspective, I think one of the biggest mistakes that I've seen in advocacy is when a group kind of makes a knee-jerk reaction to something. I think referring back to the example that I gave earlier about thyroid eye disease and that drug shortage, obviously we were going up against, a vaccine that could end this completely terrible global pandemic. And there was a risk of making it look like we were saying this treatment for a much smaller community of patients was more important than a vaccine that could save the lives of millions of people around the world. So when thinking about the outcome of this campaign, we really kind of took our time with it to really think through what are some of the processes and the channels that are available to us. We clearly wanted to get drug production going. Again, that was obviously our goal, out of this entire campaign, but we needed to find the right way forward. And in order to do that, we had to stop and pause and take a look at, what does the law say? What has been done before about this? We're clearly not the only one who's faced a drug shortage, whether it's the rare community, whether it's, cancer, there's drug shortages, they happen for a number of reasons. So to kind of help figure out, how do we do this the right way to make it, look like we're not, knocking down doors at the FDA, but obviously wanting to achieve this outcome for patients who really need this medication. We looked around to see, again, consulting those partnerships, with people who might know a little bit more about our issue, who might understand thoroughly the problem that we're facing and might have themselves seen a similar situation in the past. And we asked what worked for them. When we were also thinking about how to test our message, we looked outside and externally just to kind of say, does this sound right? Does this, say the right thing? Does this, carry that subtlety that we're trying to, accomplish here? And if you're working on a team, which I kind of was with my, communications team, and we had our leadership on board, if something didn't feel right about it, I would speak up, because ultimately that's, it's my organization on the line. And I wanted to make sure that we were messaging something in the right way for our organization, but also for the patients that we are representing. And I think, ultimately you have to, I know it's a long process, I'm sure, everybody who wants those quick advocacy wins probably won't like to do it, but you have to really think carefully about those subtleties, even if it does mean that you need to take more time than you think, because, in the end, if you don't do that and you don't exercise that level of prudence first, you run the risk of cleaning up your own mess that actually, you could be spending that time advancing your issue. So I really, really encourage other organizations to just kind of stop and pause and just think through things instead of just, issue that rapid fire tweet, get a soundbite out there, just take a minute and just think about what you're trying to say and think about if it's the right message that you want to carry.
I think that is a really, really powerful message, that, take your time, take a measured approach, and take multiple different approaches. And as you say, test that message outside of your team, outside of your immediate group, because I think when you are working on a team, you get very close to the issue and forget that what you're saying and maybe the language you're using doesn't resonate to someone outside of that immediate bubble. And so we're very fortunate to exist in a very rich ecosystem of patient-led organizations where learning from one another is key to our collective progress. So Clara, how do you encourage and foster the sharing of information and resources across many communities and borders?
Yes, this, of course, in the rare disease community is essential. I would say first at the individual level, because as Dimitar was saying, quite often there is a feeling of loneliness there. So even at that level, we really have programs like we initiated something called Rare Connect, where people could really find groups of other patients with their same disease across the world, and they could just share their stories and, have that feeling of belonging, which is something that sometimes people are missing in their own country and within their own borders. So I think that's one very important thing that as a patient organization we must do. And then at a more like organizational community level, EURORDIS puts a lot of importance on the meetings and the networking, which was quite challenging with the COVID pandemic, and we had to really rethink how to manage to do the networking online. I think we did manage in some way, but it's something that we feel a lot, like how do you create those moments where all the community comes together in one place and shares their experiences and their best practices. But I mean, we have tried to find ways to do that online, but our membership meeting really is a key moment to do that, because it happens every year. It's when everyone can really bring in their success stories or share their challenges, and really important for them to have, even in the breaks of the plenaries, the moment to discuss among themselves. It's actually the one part that we're missing on this digital new online world. And then every 2 years, we organize the European Conference on Rare Diseases. This is, again, a big moment where it's also a more multi-stakeholder approach. We try to bring in not just our members and our patients, but also the broader community, where they can hear the testimonies of our members, and we can learn as well from what is happening maybe in other areas. So really the organization of this key moments throughout the year where our patients can come together, I think is very important. At international level, it's even harder sometimes, also because there's a lot of different levels of resources, of stages at which the patient organizations are. I mean, Europe is very developed in a way, like the patient organizations have been there for a long time. And in other countries outside of Europe, they have just started. So it's also very important to bring them in, even if sometimes they might feel a little bit like some topics are more European, but we really want to foster that exchange. And we are even looking now at things like state-of-the-art resource. So how do you try to get all that evidence from all the different countries and really share it across the border? So we're starting that discussion now, but it's as we were saying, it's a long-term process.
Absolutely. I think those are the key messages, that it's all about network building and it's all about the long processes. Um, and yes, like that more informal discussion and making connections with other people is, of course, a part of advocacy as well, because it plays a huge role in getting that consensus and getting that collective voice going. So, Dimitar, there are a number of youth groups all over the world. Can you tell us about how the sharing of knowledge has impacted your capacity as a group?
Um, I personally got in touch with, kind of on an international level, got in touch with other patient advocates in the rare disease or in the retinal disease community only during the big congresses, the Retina International Congress, which was once in Hamburg, in Paris, and then actually my first real encounter was in Auckland in New Zealand, 2018. And I have to say, for at least for me personally, that was extremely empowering. That was probably the thing which absolutely catalyzed my work and my motivation to help set up this youth group in Germany. As I said, there have been some youth groups here and there in Germany on a regional level, because it's a federal state, so it's mainly regionally organized. But for me, it was really important to kind of bind them to the or yeah, channel those groups, or kind of bind them to the pro retina structure of the patient organization. So being in exchange, so exchanging the knowledge with the other groups was absolutely crucial for me personally. I don't know about the others, because I'm not sure how much contact they have had with them, with the other people who helped me establish this group. But for me personally, this was really a rich source of ideas, of even being able to see, the challenges and to learn about the challenges that the others were facing, which were in some cases really fundamentally different from those that we had in Germany. Social media probably didn't work that well here in Germany, but worked somewhere else better in, I don't know, New Zealand, for example. And but here in Germany, let's say we had much more funding for certain activities, and in Greece you would have absolutely no funding, but still you would have enthusiastic patient advocates. So it's really this I would say completely different scenarios which give you the perspective. And of course you have a lot of new ideas, you gather a lot of new ideas, and it's really a fresh perspective in general. And just as an example, we had maybe half a year ago, we established this expert talks over Zoom for our youth group. So once a month we would just meet and have a expert or like a patient advocate, like someone of us, just talking about a different topic, and maybe just initiating a panel discussion, just like this that we're having right now. And it will be something about potential treatments, I don't know, sports activities, everything else, everything that you can imagine, really very diverse. And this was actually inspired by the activities in the Retina New Zealand patient organization. I learned about that, and I was really motivated to do that, and gave the idea. And
we very much, hopefully, fingers crossed, can welcome everyone back for our Retina International World Congress in Iceland in 2022. The COVID has impacted us in lots of ways, unfortunately, and as Clara said, of course, that more informal discussion and getting to meet with people has impacted us hugely, but hopefully shortly we can resume. So I just have a closing question for each of you before we go to our Q&A. What key piece of advice would you give to our audience or others wanting to get involved in advocacy in 30 seconds or less? I'll come to Sara first.
30 seconds or less. Advocacy is really, it's a really long process. I've been here for 4 years and with Prevent Blindness, and I still haven't accomplished everything that I want to do. And you're also going to meet setbacks along the way, a lot of setbacks. They happen constantly. We just had one recently, and I kind of just had to step away and just say, I need a minute to process this. You know, this is my blood, sweat, and tears. But, you know, there's also an opportunity. So with every setback that comes, so it sounds really, you know, silver lining and all, you know, everything's going to be okay, but there really is opportunity to try again in advocacy. And I think that's one thing that kind of keeps me coming back for more is, you know, as soon as you run into a wall, you look to your left or your right, there's somewhere else to go. There's always something that you can do. So don't give up, keep going, and, you know, just do something, because there's something will lead to something else.
Thank you very much. Very powerful. So Clara, the word to you next.
Yes, really along the same lines. I was thinking, really, even if it's a long process, set yourself like short, mid, long-term goals. So you stay motivated, you build the momentum, and then don't be demotivated by the fact that there's actually a lot of repetition in advocacy. You have to hammer people, policymakers. There are changes in bureaucracy, so people change, your interlocutor changes. So just keep going, and even if you have to repeat your message, it will be heard eventually. So just keep the momentum and motivated.
Thank you very much. And Dimitar, over to you.
Yeah, I think it was pretty much said already by the others. I literally wanted to use more or less the same words. I would just rephrase it, maybe don't give up, really, even when it looks really kind of disappointing and not really rewarding, but really don't give up. Don't procrastinate also too much, because yeah, sometimes things can happen actually very spontaneously. You can really very spontaneously find someone to help you with certain things when you're doing patient advocacy. And most importantly, I think for me, the most important thing has been and still is build and find a really good rope team. You know, you don't need 10 people, you don't need 20 people. You might really need 2, 3, 4 people with whom you really get along really well, and then if that's your rope team, if you really can proceed with them, just do it. And I think this is really probably the most crucial and the most the recipe for success, I would say.
Well, I think there's clear consensus there about the key message, and that it's about not giving up. And we have a common phrase here where the squeakiest wheel gets the oil. So we really just need to be the squeakiest wheels as possible. So I'm delighted now we have just 5 minutes to go to a Q&A from our audience. So I'd like to invite anyone who has a question to please raise your hand. You can do so by pressing Alt-Y. So I see one hand raised, which is Eric Hartman. So Eric, I am going to ask you to unmute. If you just click Alt-A to unmute Eric. Eric, are you there?
Yes.
There you are.
Hello?
Hello, how are you?
I'm sorry. Alt-A doesn't work if you're on an iPad.
Oh, interesting. Thank you for that.
Unless I have a keyboard. I'm the director of advocacy for the Choroideremia Research Foundation. And we've got a couple initiatives. One of our biggest problems is 75% of our patient population internationally were misdiagnosed or underdiagnosed as having RP or other inherited retinal dystrophies. And we are undertaking 2 different efforts. One is many of us, and Dimitar, I'm sure you've seen this with some of the younger patients when they're told they have an inherited retinal disease and they're going to go blind, they don't even really see the need to see a retina specialist if there's no treatment. So the only things they end up doing are going to get new glasses through optometrists. And we've realized that's a huge potential avenue of finding our own patients. So we actually just were awarded an entire session at the American Optometrist Conference, where there will be a complete panel talking about how to diagnose choroideremia. Then on the international level, we're trying to come up with a way of helping doctors better understand choroideremia. So we developed a really good PowerPoint that has the medical slides that doctors can look at to compare RP or normal eyes to choroideremia. And what we're doing is the original doctors in Canada that put it together, and we are now going to record oral presentations in multiple languages. I guess that's one side benefit of this COVID is everybody knows how to work in Zoom. So they will bring up the presentation, and we will have a transcript in English that different people are going to be able to then translate, other medical professionals. So we're going to have Mandarin, Spanish, hopefully German. If not, Dimitar, I'll call you, and several other languages. So we can actually have a video library that we can have as a resource for doctors across the globe of how to better understand our disease. And from that, we will hopefully then begin to find our patients.
Thank you very much for those comments, and the very best of luck with all those that work. It really is important. Dimitar, did you have any comments on that aspect of those statistics? I saw you nodding your head there.
Yeah, I'm nodding my head because I think we had this conversation with Eric 2 years ago in the US on the World Orphan Drug Congress, and I'm glad that they actually managed to do that, especially the second, I mean, the first project I didn't know about, but the second project he was already kind of, talking about it, and it's really great. I mean, the choroideremia is just one of the examples of how a really small patient community, which is kind of a very distinct subgroup in the retinal dystrophies area, can actually thrive as a patient advocate group. I mean, they have done really great work, not only in the US as well, here in Germany, and they're really probably the most international among the retinal dystrophies, if there is such a category. Yeah. Nice to hear from you, Eric. Yeah.
Excellent. So do we have any other questions from our audience? You're invited to press Alt-Y to raise your hand now. So I have Mohammed Anwar. I'm going to invite you to unmute.
All right.
There you are. Hello.
Hello, can you see me?
I cannot see you, but we can hear you.
Okay, all right. So just talking about the advocacy, I don't know, but I'm from Pakistan, and in this country, especially, we don't see many hereditary retinal diseases, probably because of the different DNA structure here, or because probably the population here is more pigmented, and probably they have a slightly healthier RPE. So we don't see much of them, but we do have a series of this RP families, which we keep on seeing off and on, and the RP variants, quite a few of them actually. It's not very uncommon here. But, and there are, I'm from Pakistan Foundation Fighting Blindness, and the foundation itself is trying its best to, by and large, the RP people and some other people who are blinded by some other retinal disorders, sometimes undiagnosed in the early stage because of the lack of the facilities available in the remote areas of the country. So we keep on trying to educate them in different ways. But I was thinking that a country like this, in which the resources are less, how can we set up a kind of advocacy centers or a program? I would like to be guided on it, because if we don't see a lot of hereditary retinal disorders, then the chance is probably we are not detecting enough. We are not seeing them enough. This might be one reason. that the people think that they've gone blind because of some disease, solar eclipse or something, and they do not approach the doctor, the proper facility, the tertiary care facility, where a doctor can diagnose. Plus, the optometrists here, they are not properly trained so far. So they cannot diagnose, they actually only fix the glasses. They can't diagnose the disease, or they can't sometimes even expect some disease. So how can we actually manage this thing here in a country like Pakistan, which is partially developed and partially still to be developed?
Thank you very much. It's great to welcome you to this event. Thank you for joining us, Mohammed. Do we have any takers for that question about how to create that awareness in a country like Pakistan that, as we say, is developing? Sarah?
Yeah, I can, I can certainly try to give an answer because, the US is a developed country, but there's still a lot of areas in our country that where the population does not have access to an eye care provider, or they might not be aware that they might be at risk for a vision condition. In those specific instances, the first thing I would recommend is to take sort of an accounting of what resources you do have in a particular area. To give the US example, we look at how many community health centers are there. Is there, a location where we can, have, just an eye care provider come and visit? Is there, the possibility of using telehealth to make sure the patient is accessing their care? How can we get simple, basic education to someone just to, create that initial awareness? And so thinking of just those very, very small steps that you can take with the very small resources that you have can actually start leading to bigger things.
Thank you very much, Sarah, and thank you, Mohammed, for your question. So that brings us to the end of our webinar today. We're just at time. So I'd like to sincerely thank Sara, Clara, and Dimitar for joining us here today. Really, really engaging discussion, and I hope our audience benefited from it. I think there were some very clear messages from today in that advocacy is a long process, but that there is a structure to it that everyone can participate in. The process of gathering and generating evidence will set you up for success. And it's all about relationships. So take time to build coalitions, consensus, and learn from other groups and everyone around you. Thank you all for your time here this evening. I hope you enjoyed the discussion, and we really look forward to welcome you to another Retina International event soon. Take care and goodbye.
Thank you, bye.
Thank you, Fiona.